you start working with somebody? How do you start narrowing this down so that it can become actionable?
Yeah, that's a great question. So, kind of like what I just started explaining, I sort of have a loose four-step framework, and I say loose because it's obviously going to be individualized to the person, depending on what their symptom picture looks like, what their labs look like, what their history looks like, what they're already doing or what they've already tried and what has worked or hasn't worked. But it's really based on these four major systems in the body that really affect the way that endo behaves.
Welcome, everybody. I'm Isabel Spradlin, of course, of HealMyBelly.com. I am here today with Cindy Dabrowska. Cindy is a registered dietitian with a master's degree in applied human nutrition. She's an endo warrior and founder of the Supportive Endo RD, a private practice that uses medical nutrition therapy and functional medicine principles to support women with endometriosis and infertility. Her passion comes from supporting women who, like herself, have said enough is enough to debilitating, life-altering symptoms of endometriosis. Cindy supports endo warriors who are looking for improvements in pain, fertility, energy, digestive, and hormonally driven symptoms. As a registered dietitian and endo warrior herself, Cindy is proud to be an ally and a resource for endo warriors on their symptoms improvement journey. So, Cindy, welcome. Thank you so much.
Yeah, thanks so much for having me.
And so we've talked a little bit. Um, as many of the people who are part of my programs and who follow me around on the things that I do may know, endo is not my primary focus. My primary focus is kind of the whole range of post-surgical symptoms, abdominal adhesions. Endo, of course, functions as an adhesive process in the body often, as a result of that growth of the endometrial tissue in places that it kind of wasn't meant to be. And so the symptoms can really overlap between endo and sort of more straight abdominal adhesions. And I love your focus on the endometriosis. As a nutritionist, an RD, a functional medicine practitioner, you have a real sense of how individualized this is for folks. And so, do you want to give us just a brief overview of endometriosis, maybe pre and post surgical?
Yeah. Oh my gosh.
I mean,
Well,
that's a huge question. I can narrow it
that's a
down a
huge
little bit.
question. Yeah. So, okay. So, I mean, first of all, endometriosis is a chronic inflammatory condition. It's estrogen dependent. So there's a lot going on, right? It's inflammation. It's estrogen dependent. There's sort of a progesterone resistance component to it. But really, at the heart of endometriosis is that immune dysfunction. So in women like myself who have endometriosis, the cells of our immune system don't function as well as they should be, and that's really what's at the heart of the endometrial-like tissue being able to establish, develop a blood supply, and then like essentially a spread and grow throughout the body. So in terms of pre and post, yeah, this is a big question, and you can approach it, I think, from multiple different perspectives. I guess some of the things that I would work on with somebody pre-operatively, and actually one thing that I want to bring up is very relevant to something that you were mentioning prior to starting the recording, is around swelling and water retention. So I'm kind of going off on a tangent here, but one thing that I encourage people to do prior to having their laparoscopic excision surgery is do some of that foundational work, right? Like if you have GI symptoms prior to going into your surgery, it's probably a good idea for you to maybe spend 2, 3, or more months, just depending on the severity of those symptoms, doing some of that foundational work. Because what I find in a lot of women who go into surgery really symptomatic is that you're basically adding inflammation on top of inflammation. And I hate to sound morbid, but when you go and get a laparoscopic excision surgery, you're essentially being cut into, lesions are being removed, right? It's quite traumatic on the body. And so if you're going into that surgery extremely inflamed, extremely reactive, maybe you're experiencing constipation or some type of inflammation type stool that's very clearly indicating that there's a lot of inflammation in your body, it will really benefit you to do some of that work prior to going into the excision because, and I, sorry, I started to explain this and then I went off on another tangent, but when you're adding inflammation on top of inflammation, the way that I sort of like to describe this to people is think of like an inflammation bucket. And if it overflows, this is when women start to experience these body-wide autoimmune type reactions that they weren't having prior to surgery, right? But it kind of tipped the scales in that direction where now they're experiencing body-wide water retention, swelling. They're having reactions to things that they were never having before, right? Because like what I alluded to previously, right? It's more inflammation on top of inflammation, right? And so this is such a big question because there's so many things I can say about it, but really doing that foundational work, if you have the capacity, if you have, maybe the resources to seek out that support. But what I mean by that is, firstly, the gut, right? So if you do have GI driven symptoms, if you're experiencing constipation, if you're having loose stools, if you're seeing a lot of undigested food in the stool, if you're experiencing a lot of heartburn, reflux, bloating, random food reactions that are entirely unpredictable, these are just a few examples of symptoms that are hinting towards something not going right beneath the surface, right? And because endo is primarily a condition of immune dysfunction and 70% of our immune cells live in the gut, we have a lot of control over the way that those immune cells behave by optimizing the gut. And I want to be really clear. I don't mean to suggest that you can like reverse endo by optimizing your gut or anything like that. But certainly if you have a very good, healthy, diverse gut microbiome, that's going to have some positive spillover effects into the way that your immune system behaves. So that's one thing. Another thing could be, deep diving your hormones. A lot of people narrow in on estrogen and they think of, okay, let's throw DIM at the problem. Let's throw calcium D-glucarate at the problem. Let's throw B vitamins at the problem. Cruciferous veggies is a big one, and I'm not opposed to cruciferous veggies, but that's just one aspect of diet that can help with estrogen elimination. But the thing I want to highlight here is that estrogen is not the only hormone that matters with endometriosis. A lot of us have progesterone resistance, where maybe we're making enough progesterone, but it's not effectively binding progesterone receptors.
Mhm.
Testosterone, DHA sulfate, both of those two hormones play a big role in pain sensitivity. And if you have a fertility goal, endometrial receptivity and egg quality, prolactin can directly affect progesterone produced on the other side of ovulation. And then the thyroid also has a huge role to play because, it controls everything from metabolism to liver health, energy, all of these wonderful things that matter for endo. I know that that's a really, if you give me a broad question, I'm going to give you a lengthy answer here. I can't simplify these things. They're too important and too complex.
That's why I wanted you here because I really I value that so much. I think one of the things that my clients and the people who kind of follow me in this world like really are looking for is a recognition that this is complex, right? Because they feel that complexity. They know that they have tried an anti-inflammatory diet, that they have tried the low residue diet, they've tried the high fiber diet, they've tried FODMAPs, they've tried like pretty much every version liquid diet, right? Like they've tried so many versions of things, and to not have any of those things work really effectively or for the long term. And it just feels like they're on this constant treadmill of being let down by the promises of, well, just do this diet, just do that diet.
Right.
And I find that your ability to, well, just your education and your ability to express all of this complexity, that's why I wanted the broader overview of how you think about it, because I actually think that can be extremely reassuring to people who are going through this. So often they end up feeling like everything that they're experiencing is trying to be oversimplified or dismissed.
Mm.
And I think the way that you talk about this, the knowledge that you have about the complexity of it, is potentially really reassuring to people that it's not,
Mm.
as they're so often told, in their head, and that there is a way to learn more about it. That it's not just sort of this black box where nothing about it is known. Clearly, there's a lot known about it. So, when you're working with somebody who kind of comes in, they're in that space of, they're either pre or post-surgical, doesn't matter, I would assume. How do you start working with somebody? How do you start narrowing this down so that it can become actionable?
Yeah, that's a great question. So, kind of like what I just started explaining, I sort of have a loose four-step framework, and it is, I say loose because it's obviously going to be individualized to the person, depending on what their symptom picture looks like, what their labs look like, what their history looks like, what they're already doing or what they've already tried and what has worked or hasn't worked. But it's really based on these four major systems in the body that really affect the way that endo behaves. So I kind of already started to break this down a little bit in response to your first question. But gut and immunity is one of the first things I focus on. So if somebody comes to me and they have GI symptoms, they have some kind of like some of those symptoms that I kind of loosely went over when it comes to the gut, or if they have some kind of indication that something's off with their immune system, well, whether that's elevated thyroid antibodies, whether that's a positive anti-nuclear antibody marker, whether that's other kind of sneaky indications of potential autoimmunity, maybe they have a chronically low white blood cell or chronically elevated white blood cell count. I'm kind of decoding their labs, decoding their symptoms. But that's where I would start, right? And then because of that connection between the gut and the immune system, I'll very, very often see positive spillover effects from that gut work. And then we move into the hormone piece, which is the second step in my framework. So I kind of started mentioning, all these hormones matter. So I'm specifically looking to understand like what is this unique individual's hormonal profile, right? Because it's going to be a different set of interventions from a diet, lifestyle, supplement perspective when they have elevated testosterone, maybe driving inflammation, versus if their progesterone is really low and their estrogen is really high, right? They're both going to affect pain sensitivity in the body, but how I might guide them through high estrogen, low progesterone as a pattern versus high testosterone is going to look a little bit different. Then the third step of the framework is looking where else inflammation is compounding from, right? So endo and adenomyosis are, of course, they're separate sources of inflammation, but you'll often see things like high insulin or insulin resistance. You'll see elevated liver enzymes in women with endometriosis. You'll see nutrient gaps. And so I'm looking to see where else can we action on to help bring that overall inflammatory load down on the body. And the analogy I like to give people is like if I handed you a big heavy stack of books and I started taking them off one by one, it's going to get lighter and lighter and lighter every single time I take off a book, right? So that's what we're trying to do with that overall inflammatory load on the body. And then the fourth piece is around nervous system work. When you're living with chronic inflammation, that alone is a huge stressor on your nervous system. And over time, and this is a problem with going decades without a formal diagnosis, is because the longer you go with this chronic pain, the more time your nervous system essentially has to learn that pain pattern. And so this becomes problematic when women seek out excision surgery, have the excision surgery, feeling really hopeful that they're going to be able to live a better quality of life, regain some control over symptoms, and then it just doesn't happen because their nervous system has learned that pain pattern. So those are the kind of four areas that I work on. And to answer your question more concretely, like where I start, like I go in that order, but if somebody doesn't have GI symptoms, I'll just kind of go down the line. And then there are, of course, like more advanced investigations that I'll do sometimes, but that's a little bit rare, and it's on a case by case basis. And of course, there is value to things like pelvic floor physiotherapy and acupuncture and some of the stuff that you do around wound care and around scar tissue and adhesion prevention. But yeah, hopefully I answered that question.
You did beautifully. And so I can already hear in my mind. Well, let's stay focused on the endo for a second. So in my post-surgical endo clients, particularly the post-surgical, I've worked with some people pre-surgical who are trying to do everything they could to avoid having the surgery. And I do think now that you're describing this, and now that have found you, I know where to send them to give them the best shot of if it's really a commitment that they're not going to get this surgery, to have a much more robust support around this. Because with my work, specifically with the tissue work, with trying to relieve the adhesion, this was much earlier in my practice. Like maybe in the first 10 years of my practice, I was like, oh, well, this is an adhesive condition, like perhaps we can move the needle. But the real assessment there, I think, is that no, it's a different form of adhesive tissue. It's an endometrial tissue. It's not fibrous bands. It's not where inflammation, chronic inflammation, or low-grade infection, or maybe not even low-grade, high-grade infection, have laid down these, the precursors to collagen, and whether or not it makes it all the way to those collagen fibers, you've still built these adhesive tendencies in the tissues. That's where my work really thrives, right? Is in the sort of fibrous adhesion. And with the endotype adhesion, I don't have a lot of success with people in terms of like we can temporarily relieve symptoms, but it doesn't stay because the endometrial tissue is still there. And what I do, while it addresses the nervous system and can have an effect on the hormones through the cellular metabolism and what we're doing with the hands-on work, it's not supportive enough to really help somebody who has active endo. And so with that with that preface, one of the things that I've seen and have seen really regularly throughout the years is that for those who do elect to have surgery, whether the endometriosis, the surgeon really confirmed that they got all of the endometriosis or they intentionally left some because it was in such a sensitive area that it could have done more damage to try to relieve it or remove it. And so it's kind of a wait and see. Some combination of all of that. These surgeries can be very complex. Get most of the endo, but a small spot, leave it, and kind of watch and see and hope for the best. And even in the surgeries where the surgeons have reported, got everything, it's all
Mm.
gone. A lot of people experiencing endo and having gone through that continue to experience the same symptoms they had before the surgery, continuing on after the surgery. And it is a real bummer. Like it's way more than a real bummer. This is a life-altering thing, and it's very frightening to be told that the endo is gone. Sorry you don't feel any better. We'll see you again for like a follow-up in 7 years or something like that, whatever the different surgeons' protocols are.
Yeah.
So in that case, where the surgery was reported to be successful by the surgeons, but somebody is still having all of the experiences that they were having, all the symptoms that they were having before surgery, how do you approach that?
Yeah, so this is kind of what I was alluding to a little bit previously around that like nervous system driven pain. I mean, that's only
Got it.
one example of why somebody would continue to have pain post-operatively. I'm an example of this. Unfortunately, when I had my surgery in 2018 as somebody with endo, I didn't get the relief I was hoping for. But at that point, I had already been symptomatic for 15 years, right? So maybe my nervous system did learn a little bit about those pain patterns. But that's just one example, right? It could be nervous system driven. It could be pelvic floor related. There was another great speaker at that forum where we got connected who was talking all about pelvic floor work. And I have seen pelvic floor work and likely a lot of what you do as well just be absolutely transformative to women because we do see a lot of like because you're dealing with that chronic pelvic pain and pain in other areas of the body, we see that like chronic tightening and clenching and bracing, right? And eventually the muscles learn that behavior too, right? They're either clenching or they're very weak, and that can also influence pelvic pain. So that's another big driver. In terms of how I approach those things, with what I do as a registered dietitian working in this space, I'm working with a lot of like nutraceuticals to help with the nervous system driven stuff. Foods that might help on the nervous system front, but really that needs to be more pain reprocessing, like brain pain reprocessing, which is not my area of expertise. But some nutraceuticals have decent research, like PEA, L-arginine, things like this. And then for the pelvic floor stuff, obviously, I'll refer out for that as well. There's also the potentially hormonally driven pain. Again, this is a big part of my story. I didn't stop like vomiting or fainting or passing out from pain until I was able to fix how my body was processing and metabolizing estrogen. So it was a big part of my personal story. And yeah, like as much as like we know that the endometriosis lesions are a source of estrogen, right? That they have heightened aromatase activity, which is that enzyme that converts testosterone into estrogen. So we know that that's very characteristic of the lesions. And so when you surgically remove them, you often can see a shift in the hormonal profile, but sometimes it's not enough, right? There's also what's happening in your blood, and if there's a stressor on your liver which processes estrogen, or if you're chronically constipated, you're not going to be able to get it out, and that can cycle back into the body. And so that's where I feel like what I do can be very, very beneficial, because we are working on tweaking the diet and supporting the gut microbiome through diet, through nutraceuticals, through lifestyle factors. Um, and then if it's more like immune system dysfunction driven as well, then again, I think the type of work I do can be very, very beneficial there as well, because we're working on, setting habits and creating habits around the foundations that support a healthy immune response: sleep, stress management, replenishing nutrient gaps, moving your body, eating an anti-inflammatory eating an anti-inflammatory diet that's also very supportive of the gut microbiome. And so, yeah, we can't reverse that dysfunction, but we can certainly, make an effort to make it better. So yeah, that's how I would. It's very, very unfortunate, and I do find that the women who don't experience symptom improvements or resolution post-operatively, unfortunately, do tend to be the more severe cases, right? So. Um, yeah, did I answer that question?
You totally did. I did want to say, um, two things. One, I love that you gave a shout out. Jessica Corman was the PT on that you did the other forum with, and we will be interviewing her next week. So yeah, and she actually was how I found you, how I found that forum, and then found you. Is we're both in Portland, and I've been referring to her for a lot of years, and she's really talented, really phenomenal. And so maybe one of these days we can have you both together, and we can do a joint interview and get lots of different perspectives.
Sure.
So yeah, the just to reinforce, because my work also is not internal PT work. I am also not a PT. I'm an LMT and an RN, which is a huge scope, but it's not PT. And that work is really so supportive in the nervous system retraining. And also, I think there's so much around breathing, like the compartmental breathing and the way that we load the different compartments in our body with tension when we breathe or don't breathe. I mean, everybody's breathing. What nobody's like
Yeah.
not breathing, but just learning how the compartments of the body really work with the breath, and then that in turn, it's kind of what you were saying. There's so much that we do that in turn supports all of the various other systems. So, if you can kind of get your compartmental breathing more in line with what's happening in your body, then that's going to support your nervous system, which is going to support your immune system. And just all of it kind of has these cascading effects. But one thing I wanted to ask you, because I can already hear all of my folks in the back of my head being like, does she only work with endo? So, Cindy, if I suspect that the answer is yes, you only work with people who have endo.
Mhm.
And then for the people who don't have endo but are really resonating with what you're saying, how would you guide them to find somebody similar to you who can kind of deep dive with them in this way and make it really personalized?
Okay. So yeah, I prefer to work only with endometriosis patients or adenomyosis patients, or women who suspect they have endometriosis. Like, it's not required that you have a formal diagnosis to come work with me if sort of the pieces fit or align. So yeah, I think that answers that question. I just don't think I would be the best resource for somebody who maybe doesn't fit into my area of expertise. Like, I'm more than happy to answer questions and things like that if it is something that I know a little bit about. But if it's something completely outside of what I feel comfortable supporting somebody with, I'd obviously refer elsewhere. And then in terms of your second question, I mean, I do have like a little community of trusted practitioners that I like to refer to. Um, it's a little bit tricky for me to answer this question because I am so niche, it is, almost exclusively women with endo coming to me seeking support with their endometriosis symptoms and or fertility. And so I'm not really connecting with a lot of people who like don't align with my area of expertise. So I've actually never really been in a position where somebody's come to me and been like, I need a referral. Unless you're referring to like the team, like a surgeon or like a pelvic floor physiotherapist, then in that case, I do have a couple of practitioners that I like to work with and refer to. And typically after a couple of questions, I'll kind of have a general idea of, who they might benefit from a referral from or to. So I'm not sure if I'm answering your question.
That's
Uh,
great. Just,
yeah,
yep,
okay.
that's great. Thank you so much.
No worries.
Wonderful. Well, is there anything else that you would like to shout out? Where do people find you?
Sure. So my most active platform is Instagram. So my handle there is endo.fertility.dietitian with two T's, no C. I also have a pretty active YouTube channel. So my handle there or my channel name is the Endo Fertility Space channel. I have a Pinterest, I have a TikTok, same handle, endo.fertility.dietitian. And I have some blogs on my website, which is just endometriosisdietitian.ca. Um, and that's it. I'm quite responsive in DMs and things like that. So if you do find me on Instagram, feel free to say hello.
Wonderful. I think we will just leave it there for today and hopefully have a chance to talk again in the future. You are a wealth of information and so approachable and so knowledgeable. Thank you. I can't thank you enough for being here today.
Yeah, my pleasure. Thanks for having me.
I hope the interview was useful to you. If you liked it, subscribe to the channel, subscribe to my blog at healmybelly.com, and tell a friend. I look forward to seeing you again.